Hello, everyone, and welcome to the AANMC webinar about heart-centered education in naturopathic medicine, honoring the VIS. I am Joanne Yanez, Executive Director of the AANMC, and we are so pleased to have you with us. Before we begin, please make sure that your control panel is expanded. There should be a box in the upper right-hand corner of your screen. If you don't see this box, look for a double arrow. Click those and your box will expand. Second, make sure you can see my desktop, which is currently displaying the first page of the presentation. At the end of the webinar, there will be opportunities to ask questions. Please note, everyone is in mute mode right now, so you can type your question into the question box and indicate if the question is for myself or the presenter for today. We will try our best to address as many questions as possible during the Q&A after the presentations have concluded. Please feel free to send any unanswered general questions to info@aanmc.org, and we will show that email later on. However, if there are specific questions to the presentation and we may not be able to address them outside of the time constraints of this webinar. If you have any technical problems during the webinar, you can also communicate with me in that question box, and I'll try to help you as best as I can. A recording of this webinar will be available in approximately 1 week, and we will notify recipients about that. So today, I'm excited to have with us Dr. Alexia Georgousis. She is the Associate Dean of Clinical Studies and Director of Residency at the Boucher Institute of Naturopathic Medicine in Vancouver, British Columbia. And we are so happy to have her with us. She has been in private practice since 1999, recently moved from Toronto to Vancouver to accept the position of Associate Dean. While in Toronto, Dr. Georgousis was part of CCNM's clinical faculty and was the recipient of the Excellence in Clinical Teaching Award in 2008, as determined by the graduating class. Dr. Georgousis has trained in interdisciplinary mindfulness meditation, transformative mindfulness through the University of Toronto, and she's the founder of ND Synergy, a Toronto-based group for NDs to meet and share their hearts and experiences with each other. Dr. Georgousis is a strong advocate of less is more and simple is always better. She enjoys playing tennis, hiking, and singing to bring balance to her life. So it is my honor and pleasure to turn it over to Dr. Georgousis. There will be just a brief moment of pause as we switch over screens. So please bear with us.
Hello, Dr. Yanez, and thank you very much. Thank you, everyone, for attending. This is the first webinar that I have ever done, so it's a little bit odd speaking to my computer screen rather than seeing faces, but I'm sure there'll be a connection along the way. So first, I want to say thank you for attending and for your attention. And the biggest part around this talk in terms of actually doing the webinar, and I'm just going to move ahead on my slides here, was really around promoting an awareness. And this is related to remembering why the profession chose us. For myself, I feel that, you know, yes, we made a conscious choice to decide to go into this practice or this field of study, but I do feel on a bigger level that there was something about the profession that called us, and I believe that came probably to speak through our hearts. So the biggest part around this, I mean, Dr. Yanez talked about my background, and I really found that in the transition between leaving my practice in Toronto and coming to Vancouver, that the most healing and the most value came from the connection that I was able to develop with patients, but as well as myself, as well as our medicines. And one of my patients in particular had sort of summed it up quite perfectly. And she said, you know, really the relationship that you have with a naturopathic doctor is unlike any other healthcare practitioner. And I really truly believe that if anyone has any sense of doubt or questioning as to why they are in this profession, try as much as you can to let it go. I know it's easier said than done, but the value that people receive from our practice and what we do is unbelievably powerful, even if you don't think you might be helping somebody. So I found this is a really unique profession to be in, and part of it is again related to the VIS and how we also honor this in who we are and our work. So I won't spend a lot of time on an overview, but basically, you know the topic from the title. But what I would like to ask to make this a little bit more interactive is your description or definition of the VIS. And there's no right or wrong here. If anyone out there, whoever's listening, if a couple of you would, type something in and I can share it, and just to discuss it a little bit more. So your description or definition of the VIS, so if anyone can just write in, that would be great, and I will read it out. I'm just seeing if anything's coming through here.
Yeah, everybody is in mute only mode, so they're not going to be able to speak.
Okay, can they type?
Yes, they can type.
Okay.
However, we may have some prospective students that might not know a definition.
Oh, right. Okay, thank you. All right, so I will carry on then if no one's able to type in. But basically this, as I said, is no right or wrong answer. And one of my colleagues here, the resident here at Boucher, I asked her what her own description of the VIS would be. And she gave something that was really quite poignant and I thought quite beautiful, which is the spirit that moves through all things. And so just as a starting point, this is what I'm referring to when I talk about the VIS. And whether or not you are spiritual or religious or nothing at all, that really doesn't matter. It's really a matter of being more open and accepting. So given that the VIS is something that's a big part of naturopathy, we also have to look then at the dimensions of the VIS. And the dimensions include, of course, mind, body, and the heart of the spirit. The mind and body, the facts, the assessment, the physical diagnosis, all of this is very important. But there's also something that's on a deeper level, something that would be what I would refer to as intangible and not something that's typically learned in a textbook. It's more from experience, and that's the ability to connect both to the VIS of the patient and yourself and allow that relationship to develop so that healing can occur. So the heart or the spirit is really like the portal in terms of receiving and connecting. So given that this has many dimensions, it also begs the question around looking at our particular role as naturopathic practitioners. And it is absolutely multifaceted. We have many hats we have to wear. And I know from being in practice, as well as I'm sure many colleagues would agree and students agree, that when you're seeing patients, you have to wear many different hats. And this is taken from Dr. Schweninger, who was best known as the private physician for German Chancellor and Bismarck, and he practiced a lot of nature cure. But if you look at more so the qualities that he's referring to rather than the titles of the role, like courage and mildness, decisiveness, aggressiveness, familiarity with death, tenderness, and then wisdom. These are qualities that, again, it's not something that is learned through reading a book. It's something that is learned more through exploring the self and exploring the relationship you have, because we know that being a naturopath, you have to be courageous in healthcare. Sometimes it's very scary to not know what to do next. Sometimes it's also can take a lot of courage to deal with any criticism that you may receive in terms of being in the profession. There's also the part around working with decisiveness. Sometimes making a decision can feel really difficult, but all of these qualities, again, are more developed through the experience and the deeper parts of ourselves. So if we were to translate this in more modern day words or terms, I would say that the warrior represents courage, of course, philosopher, curiosity, reflection, questioning. And this is very important because we always have to question. If you don't understand something, then question it. If there's something you don't agree with, it's also important to, again, reflect and question. The same thing around spiritual advisor. This is something around that is a touchy situation for some people, but at the same time, we all know it's a big part of our lives on some capacity. And even if we refer to it just as nature or just, something that's part of the universe, whatever term you use, it's around looking at the quality of being open and accepting. So compassion and forgiveness, and also things like empathy and acceptance. So all of these all of these heart qualities relate to the roles and the hats that we need to wear in practice, and as well as advocates for the profession. So we are part of the healing process. We often forget that. It's easy to forget, but there is, again, looking at the relationship you have between yourself, the patient, your world, and the medicine that we use, and not forgetting that, again, this reiterates around connection. So what I'd like to ask, if you can identify a person, either living or dead, whom you respect and admire, and why. And I'm hoping someone will write in so I can feel that someone else is out there. But I don't need to know the name of the person, but just what is it about this person that you respect and admire? And I'll see if I get any responses. Anyone writing in? Okay, it doesn't seem like there's any response to this question, which is fine, but it is something that you can just think about as well, because typically it's not so much, the
We
title that the
did we
person
did
has
just
or
we
the,
did just
you
get
know,
we did just get a couple. So respect and passion
oh, we did? Okay.
for a bigger purpose.
Respect and passion. Okay. For the,
Compassionate.
okay. Any others, or that's it?
We got two.
Okay, great. Well, thank you for those of you who wrote in. And again, this is exactly those kind of qualities that would be qualities of the heart, or the intangibles. And it really relates to how we feel. So the compassion, the gratitude, empathy. I highlighted some of these, which I thought were great, but they're all great. Sensitivity, being authentic, being fair, altruism. All of these are really related to what we feel, which is, again, speaks to the connection. And when we feel connected, we feel seen and heard and accepted and supported and safe and respected, we belong. And usually in those situations, that's when we can thrive. But in order to develop the connection, we have to look at how do we learn to develop this kind of connection. And this isn't so much about social skills, it's about looking at something that's quite a bit deeper. So cultivating qualities of the heart is, or the spirit, for lack of a better word, is really how we can work with developing the connection which can benefit all of us. So one of the quotes from Benedict Lust from the Nature Doctor's book is really looking at naturopathy comes from the heart of nature. And again, even the reference of the heart in nature, there's something about that word where it's not just the physical description of the heart, but it's also the energy that it represents. That when someone talks about anything in any capacity and you say, does that person have heart? Or, does this team have heart? It's a sense of openness, it's a sense of welcoming, and it's a sense of healing. So the next part is looking at what is then the vis, or this spirit that sort of moves through all things, asking of us in relation to how we prepare for our role as naturopathic doctors. And this is incredibly important, I found, both in practice as well as in my role right now, in terms of looking at how we educate our students who are going to be the future naturopathic doctors. But what is being asked of us? And that's where the heart-centered education comes into play. And this is really just to represent the inner world being included in the experience of learning and teaching and practicing and just being, how we relate to each other, how we relate to, our own deep parts of ourselves incredibly important. How do we relate to the planet and the relationships we have around us? So many terms for heart-centered education could be, there's lots of them out there that basically reflect the same thing. Spiritual awareness, mindfulness or contemplative practices, reflective practices, religious practices. You could look at something like soul development or heart intelligence, the idea of just being conscious or awake. That's quite common in First Nations. But whatever practice or faith out there, it doesn't really matter. If you don't have a practice or a faith, that's fine also. It really is looking at a quality again of being open and present, because that can be incredibly powerful. So some of the facilities developed through educating our hearts, which what I mean by facilities is this is sort of an aptitude that's very natural. It's more than just a skill set. It's something that is typically a skill that's not so much rehearsed or rote. It's actually something that just comes very naturally. So communication skills, listening skills, being able to collaborate, leadership, adaptability, as well as learning how to make healthy boundaries, which is very important, all lead to being able to connect and vice versa. So how does this relate again now to the naturopathic student experience, or I would say most medical student experiences, is that we know that unfortunately the program is intense, it needs to be intense, but the feelings that can happen are things like being overwhelmed, disconnected, fatigued, disengaged, anxious, and depressed. I know that many of my colleagues, including myself, we all went through this in different parts within the program, and we still enjoyed it very much. It's just that it can be very, very stressful, and it's a little bit of ironic that learning how to be naturopathic students or naturopathic doctors, and yet experiencing this type of stress levels that can seem that it's unnaturopathic, but yet how do we look at supporting ourselves, not only in the educational institutions, but also when we get out in practice? Because getting out in practice, as soon as the rubber hits the pavement and you start to set up your business and start to see patients, it's also very easy to hit burnout quite readily. And I found that, myself included, many colleagues I've known have experienced burnout between around the 10-year mark to 12-year mark. And that is really telling. It means that there's something that needs to shift around allowing us to have more sense of support and again, a more sense of receiving. So one of the studies that I was looking at showed that the stress levels in medical schools were correlated with decreased empathy, which is really no surprise. We know when we're burnt out, when we have stress, there's not a lot of sleep and anxiety, and relationships fall apart, life happens. And the burnout was classified as feeling emotionally exhausted, having depersonalization or loss of identity, and also a low sense of personal accomplishment. And this was, nearly half of the medical students that were surveyed exhibited these having burnout. So the next step is looking at the evidence that shows that spirit or heart development in healthcare and education is beneficial across the board. That includes students and faculty, also physicians, and also patients. So I'm going to show you a few studies that reflect this and demonstrate how beneficial this aspect of education is. One study in particular looked at the benefits of spiritual and religious training, which is quite specific for medical students and faculty. And what they found that the group that was who participated in the spiritual and religious training less often described relationship conflicts within their medical team, also work-life balance, and emotional stress arising from patient suffering. In addition, the same study also showed that it looked as if this aspect of development could also influence coping strategies with encounters of patient suffering, which we all know, especially when you're again wearing many hats of being a naturopathic practitioner, it can be incredibly challenging to hold a space and be in the role that you need to be when someone is experiencing a tremendous amount of pain, both emotionally and or physically. So the trainees again here showed that they used prayer, faith, and compassion as a means of coping, whereas the non-religious or non-spiritual trainees discussed compartmentalization and emotional repression. And then thirdly, I look at this as a benefit, although it wasn't stated as such in the study, but the respondents who again were part of the religious or spiritual practices reported struggles with issues of personal identity, increased self-doubt, and perceived medical knowledge inadequacy. And what I'd like to ask you, any of those guys out there who would like to respond, why would you think this is a benefit? I see this as a benefit, but if anyone could answer, that would be great. Why do you think I may see this as a benefit? Anyone?
No answers yet. I'm still checking it
No
out.
answers?
Wait.
Okay.
Can you repeat the question, please?
Yes, the question is, why would this be a benefit in
Uh,
terms of losing sense of personal identity, increased self-doubt, perceived medical knowledge inadequacy? I look at this as a benefit, but I'm asking, why do you think I believe this is a benefit? Like what is positive about, struggling with your personal identity or having self-doubt or having a perceived medical knowledge inadequacy? What quality is developed when this happens? Or qualities, rather.
one person has said it helps you strive for improvement.
Absolutely, yes. Helps to strive for improvement. And yes, that's exactly what I was going for, is essentially this also is part of, again, developing humility and developing curiosity and questioning, because knowing that you don't know all the answers is very, very helpful. And a quality like humility, for example, is something to give you a self-check, but it's important in your life as a person, but also especially as a doctor. But improvement is a big part of it as well, something to strive for and have clear expectations. So thank you, whoever
Yeah.
wrote in.
We've got curiosity, critical thinking, sympathy, more of a relation to your spiritual belief system.
Exactly, yes, curiosity, questioning, absolutely. All of that is correct, and that's exactly why I think this is a positive thing. I think it's a discussion and discussions that need to happen because it goes to a deeper place in ourselves. So thank you. So another study that looked at empathy and physician health. So we looked a little bit at the benefits of spiritual and religious training or exploration with medical students and faculty. But now we're looking at the physicians, and physicians who actually had more empathy basically experienced less stress, cynicism, and burnout, which is hugely important in the healthcare field. Which again shows that how do we develop something like empathy? Now we're going to look at the heart and spirit development and empathy, and particularly in physicians, and the impact on patients. So that's really the impact with the patient relationship. And I'm specifically looking at the qualities of empathy and compassion. So this is a relatively recent study that was looked at 719 patients with a new cold onset. And essentially the patients had to evaluate their interaction with their physician as either having no interaction, a standard interaction, or what was called enhanced, which was really demonstrating, the physician was demonstrating empathy with the patient. And then the patients had a subjective scale, which is what was called a consultation and relational empathy measure, and as well an objective measurement of using the interleukin-8 and neutrophil counts were taken at the baseline and then 48 hours later. And what's really fascinating is that the patients who perceived clinicians as being empathetic or quote unquote perfect had not only reduced severity and duration of their cold symptoms, but also a change in interleukin-8 and neutrophil counts, which is incredibly, to me, powerful around the aspect of, again, the connection and the experience that the patient felt. So something was received that allowed these patients' immunity to actually have a change. This is to sum up the skills. This is a study, or an article rather, that actually I had received from Dr. Paul Epstein, who you may or may not know. Anyway, it was called The Healing Skills of Medical Practice. And this was based on a survey of healthcare practitioners, both from conventional medicine as well as alternative and complementary medicine. and they had these people identified a certain number of healthcare colleagues who really they considered to be healers. And what they did was ask them, what was it that they did to make the pardon me, the experience better for the patient? What was healing about the interaction that they had with their patients? And this is what they came up with. And look at the subtleties of what this is. This is, again, more to me, when I read this, I look at it's more about developing a connection with somebody and being very present. So letting the patient explain, being open, taking time and listening, sharing authority. All of these are incredibly valuable in terms of allowing the patient to feel something from just being a rote service. So speaking of service, this is from a man named Fred Lee, and he is quite fascinating. He's I think was a manager rather at a number of hospitals, and he also worked for Disney at one point. And he's looking at the difference between experience and service. So the quality of experience versus quality of service. And again, I know from private practice, the patients who referred to me more often were people where there was a strong connection, and that was incredibly valuable. So it affects everything. It affects your return visits, it affects the referrals, and it affects the recovery. I would also say it also affects rather the what the practitioner receives from the patient, because again, it's a relationship that's developed. So there's a difference between having an excellent service, but when you look at excellent experience, I would like to ask you, what's the difference for you, any of you who are listening, between having an excellent experience compared to excellent service? If anyone can answer that, that would be great.
Okay, I have one for you. Excellent service seems to be unidirectional.
Okay, unidirectional. So more linear, perhaps, and I would agree. There's absolutely more depth to the word experience and even the feeling, because we all have had probably very good service, but then when we've had a really great experience, there's something else there. And
one person brought up
yes,
with an excellent experience, there's more of an exchange.
nice. Yes, I like that. More of an exchange, absolutely. And again, that goes back to being much more personal, and again, the connection, which is really, to me, part of the vis. So thank you for answering. So where to begin? Well, it's not a difficult place to start, because all of us, we know that we have hearts and we know that we have these qualities that are there. It's really a matter of exploring and getting a sense of what it is that allows us to open, what it is that allows us to be more explorative and develop more curiosity. And some questions that you could look at that would be called self-exploration questions came from a book called Cultivating the Spirit. And it's really quite fascinating around looking at how college, the experience of college, can enhance a student's inner life. And I think that's true of probably anyone who'd be involved, faculty, administrators, as well. So some of the questions, who am I? Maybe some of you have already asked this, but I would say that it's probably important to look at these questions every so often in your life and get a sense of what's changed, what's improved upon, and what might be different, what's new. So the ones for me hit me deeply are, what kind of person do I want to become, and what sort of world do I want to help create? Because that's just how I am, but everyone else is different. But this is where you can start. And overall, a well-educated heart helps us be better people, better doctors, and better leaders. This profession that we're in terms of naturopathic medicine, has an incredible uniqueness about it that has incredible value. And again, it's something where we hold a responsibility to ourselves first and foremost, because really it's between us and whatever else is out there. And how we use the tools and how we work to educate ourselves and open our hearts is incredibly impactful, both to our patients, our families, our relationships, and whomever or whatever we come into contact with. So thank you very much for your attention. And this was a little bit different for me, so I hope it was somewhat enjoyable. I was a bit nervous, I would say. But in closing, I think Aristotle says it perfectly. Educating the mind without educating the heart is no education at all. So thank you very much for your attention, and hopefully you'll join this profession as well. And those of you who are in it, stay with it. Thank you. And any questions, please let
Yes,
me know.
yes. So I have a question here for you. Uh, was this study correlated to healthy patient-physician boundaries?
Oh, the study about the colds, the new cold onset?
Yes.
I do not know. That's a very good question. And when I'm curious, when you say physician and patient boundaries, can you give me a little bit more about that?
Um, Empathy, less burnout, less stress.
Yes, I do not know. That wasn't really mentioned there in terms of that study. If you're referring to the one about the patients with a new cold onset, they just looked at the physician demonstrated to be caring and empathetic and listening. So I can't answer that fully. I apologize, but
Okay.
I could get back to you. The study has a link there as well.
Okay. Thank you so much. So there's another question, and we actually get this one quite a bit at the AANMC, and it has to do, and I think, I'll rephrase it just a little bit, but it has to do with students considering ND versus conventional medical care. And can you speak a little bit about your practice and how you interact with other physicians, the type of respect that you get, and just what in general your experiences as a practitioner for the last 15-ish years?
Sure, sure, absolutely. Well, I'll start with the question around the relationship with other practitioners. And I can tell you in the beginning of practice, I don't know what it was, but I found that, it depends on often where you practice, but I found that I was doing some talks at a couple of hospitals in Toronto. I did a talk at North York General and one at Sick Kids. And I found some of the physicians were incredibly receptive. And then there were others who were not. And what I found that I needed to struggle that I struggled with in the beginning, and then I finally let go of it, was I couldn't please everyone. I needed to be able to be true for who I was and what I was doing, and it wasn't my role to try to convince a medical practitioner, a conventional medical doctor, to believe in me, and it wasn't my role to actually convince them that what I practiced was medicine. And what was interesting is that as soon as I let go of that, I found that had much easier relationships with conventional doctors that were in near my practice. I did find in general that the more seasoned practitioners in general, I don't want to offend anyone, but ones that had practiced for 10, 15, 25 years and up were much more open and much more accepting. There was a physician down the street who I had a fantastic relationship with him, and he was a little bit older, but he was also not North American, and I don't know if that had something to do with it. He just had a little bit more openness, but I don't want to pigeonhole anyone. I think that ultimately the lesson there is just be true to yourself and allow yourself to feel that and believe that what you do is true for you. And again, it's around boundaries. To go chasing approval or chasing, for someone, the conventional medical world to accept us is really a kind of a waste of energy. What we do, we have more evidence base coming through, we have more support overall, which is a good thing. But it's also knowing that we also have to remember that ultimately our role is to treat our patients and work with our students, correct? Um, does that answer the question?
Very well, yes. And I think,
Okay.
just tagging along with my own experience in that as well, I think that,
Yes.
when you really see people, uh, attacking you, or, and this is true in any facet of your life, uh, you have a choice to engage or not to engage. And I think you brought up a really important point that, we're responsible for our own thoughts and emotions, and we're not responsible for the thoughts and emotions of other people.
Yes.
And so I think that, that's the type of thing that there are going to be people in any facet of your life that will either, judge you or approve of what you're doing. And it's really up to you to be happy with where you're at, the decisions that you make in any facet of your life, and not to let those judgments or, misconceptions alter your own perception of yourself.
Exactly, exactly. And I would say that, even my parents, when I initially decided to go into naturopathic medicine, and I previously had a very secure career in government, so it was something that was a big step, and it was challenging, right? Because they were thinking, why would you take this path? And there's a saying, right? We know what we know what we know, and when you know it, you just do, and you start to question it on some level when you get influenced from people outside you. But yet now my parents are the biggest advocates of naturopathic medicine that are out there, right? So it's really quite interesting that how that can change. But ultimately, as Dr. Yanes was saying, the responsibility for your own beliefs and your own thoughts and your own responses to whatever stresses may come about. But again, the proof is in the pudding. When I left my practice, and now I'm starting a private practice here in Vancouver, but the amount of gratitude that I received from patients was absolutely overwhelming, even with patients that I actually didn't believe I had helped very much. It was quite surprising to me, and very, very humbling. So again, the reality was the absolute proof was the evidence that I had with my own patients, and that was fantastic.
There is a question here for you. What
Okay.
resources or self-improvement strategies do you have to improve your own heart-centered education for naturopathic medical students?
Um, Resources, are you asking me specifically or just as suggestions? Well, sorry, think I just answered the question as I said it out loud again. But one of there was this book that I referred to, which is called Cultivating the Spirit, and that was a book that was, I think it's at least 7 years. They studied college students and looked at the relationship with really cultivating the heart. That's a really great reference to look at. In addition, I would suggest anything around um, mindfulness practices. It doesn't matter what faith or religion, and anything that's explorative, where you sort of challenge your own comfort zone and get a sense of experiences that make you feel a little bit uncomfortable. Patient interaction, for example, if there are patients that you find challenging, the questions would be, why do you find it challenging? What is it about the patient that is bringing something up in you? Or it can be also related to your own academic performance, or how you are with other people. Any of those are great ways to start. But in terms of resources, I would look at those books in particular, The Cultivating Spirit. There's a ton that's through the Stanford Center of Caring. They also have a whole program around looking at contemplative practices and cultivating compassion in medicine, and empathy, which is, I can absolutely provide Dr. Yanes with the link to that as well.
Can you speak a bit about why you chose to be a naturopathic physician?
Sure, I can. For me, I was always attracted to medicine. My background was in sport. I had a phys ed degree. My mother was a physical education teacher, and I'd never wanted to teach, but what I liked was something to do that was complete around mind, body, and spirit. I used to always think of, I loved how the Olympic athletes trained, and how at that time in the eras where the mind was trained, the body was trained, and the spirit was trained. I thought it was the most complete way to be on this planet. And after I had left sport education, I was working, and I sort of dabbled in a few different things. I was decided to go back into medicine, and I left quite a secure job to go into medicine. I was at the University of Alberta struggling through a physics class, and one of my classmates actually mentioned to me that she was going to study naturopathic medicine or dentistry. And as soon as I heard naturopathic medicine, I was completely drawn in, and I actually just said, I need to find out what this is. I have no idea. And this would have been back in 1992, I believe. Anyway, the rest is history. As soon as I found out there was a school in Canada, I was looking at going to Portland and National, then I jumped in, and that was it. So it was just something that I felt. It was really something that I felt.
Thank you. And there's another question here. As for naturopathic medical students who are passionate about community organizing, public policy, how can you incorporate, or how would you see incorporating heart-centered public education into conversations with policymakers?
Wow, great question. Um, you know, I think that probably the best language to use would be around mindfulness or being present. And I think that this is safer for people to look at how we can work better and work smarter. And there's a ton of references out there in terms of business, and I'm sure you could find something around policy where it really relates to the collaboration efforts of people to work together. However, if you don't have the administrative support or a team leader or someone who has bought into the idea, I don't want to say buy-in, it's really around a belief, but has decided to say, yes, this is how I want to lead, then it may be more of a challenge, because it's never just one person, right? You need to look at everyone working together. But I would say there's quite a bit of sort of business practices now that are coming out with looking at contemplative business, heart-centered businesses, where these types of leadership skills are looking at policymakers and looking at how people run their businesses all over North America and the world.
Thank you. Yes, and just tagging on to that, I think that I've worked in public policy both at the state and at the governmental level. And when you come just from an authentic place, and this question was from Griffin, when you come from an authentic place, I think people recognize that. Uh, so often they're used to people coming at them who just want something, and aren't really there to give or listen. And I think that any of the practices that you take, uh, and when you are coming from a centered and grounded place, politics and public policy is not always the best for inspiring being centered and grounded. and and I think that, anything that you can do to help just promote that within yourself demonstrates leadership by example. And that
Yes,
was
very
one
well
of
said.
and that was one of the things that I always had as a comment to me is, wow, you really live what you preach. And when everybody else is grabbing a donut, I'm going and getting a salad, or trying to get a healthy snack. When we've done policy days, uh, we are very mindful of the type of food that we serve the legislators. And in fact, they would always make a comment, oh, wow, we're so thankful that the naturopaths came through because you guys have the healthy and good stuff. And so I think it's really just being true to yourself, that when you're coming from an authentic place, it's easy to do. When you're not being authentic and true to who you are, it comes across. And so I think that the best thing I can say from a public policy perspective is be yourself, represent the medicine well, represent what we have, and so many of the strengths that we have in naturopathic medicine are transferable in many other arenas, including public policy. And those are the areas that, as long as you're coming from an authentic and grounded place, that will come through and will be an asset in public policy discussions. When, voices are elevating, you know how to control yourself, and you know how not to be, the get roped into someone else's circus, so to speak.
Yes, I would agree, Dr. Yanis, and also I would say there's something about being detached, learning a detachment from outcome, because it's very easy to get very caught up in what you want to see happen, and sometimes that can throw you off and create a lot of extra suffering that doesn't need to be there. So, as Dr. Yanis was saying, the authenticity, the self-regulation is and really just being genuine because people feel it, right? It's like when you're going into a store and somebody's trying to sell you something. If it's too much and too aggressive or too pushy, you just want to walk away. So yes, I would absolutely agree with everything Dr. Yanis was saying too.
And one other thing that I would add to that is actually it was a topic of the first course that I ever had in naturopathic medical school, which was taught by Jim Sensenig, who is an elder within the profession. And Dr. James Sensenig taught our Physician Heal Thyself and naturopathic philosophy course. And the first thing he said in the first class that I had in naturopathic medical school was, if it boils down to nothing else, it always boils down to the relationship. It is
Mm-hmm.
all about relationship. And so in the public policy arena, with patients, with any business interactions that you're doing, when you have a relationship, a real true relationship with someone, it just makes the interaction so much more meaningful. Uh, People will be truthful and honest with you when they might not have been otherwise. I've had many interactions in the policy arena where people have said, just because of the relationships that I had with them, hey, listen, this is, I'm telling you this off the record. This is going to happen. This is not going to happen. This is why, or this is what's going on. Don't take it personally. And so many things will happen and be and flow because you have a relationship there. And so I think, just tacking on one last little piece and quoting Dr. James Sensenig is,
Mm-hmm.
it boils down to the relationship. And so if you can
Yeah.
remember that in your interactions, whether they're, contract negotiations or patients or public policy, develop those relationships because that is where the heart is.
Yes, yes, absolutely. It is. That's exactly where it is.
So
Nice
I
closing.
thank you. So I don't see any further questions. And with that, we're going to close today's webinar. I do want to, and I have it up on the screen, alert you all for an upcoming event. The Naturopathic Doctor's Central Application System. We have just launched a new version of that, and so we are going to be hosting a webinar on October 14th about applying to naturopathic medical school using this new format, or revised format rather. We will also be having a webinar, date is to be determined, in October, on financial aid and financial responsibility in naturopathic medical school. So stay tuned for that. You can find out more information at aanmc.org/events. And any further questions, you're always welcome to send at info@aanmc.org for questions. And that's it. Thank you all for coming. Thank you, Dr. Georgousis, for your time and heart in this.
Thank you. Thank you very much.
And as I mentioned earlier on, we will have a recording of this webinar up in about a week's time. So thank you all for coming, and that concludes our webinar today.